Ministry of Health officials have raised an alert over the reckless disposal of the masks and clinical waste as the country's COVID-19 caseload continues to rise, crossing the 23,000 mark today. Now, 6 patients died over the last 24 hours. Gov't gives us more details.
Face masks have become a critical protective gear in a time of a highly contagious virus. However, it is not uncommon to find Kenyans in public spaces without the masks, with some donning the protective gear improperly. Research has shown that a person not wearing a mask increases the risk of infection of COVID-19, even if one person is wearing and the other wearing it, albeit incorrectly. Health officials have noted that used face masks and hand gloves are littered all over public installations.
There is also the danger of infection by those who come into contact with face masks blown by the wind. Careless littering and handling of COVID-19 medical waste and other forms of waste poses high risk of infection. Improper disposal.
Findings from a research conducted by a local lab show the virus can last on a surgical mask for a period of 7 days. This means that disposing the mask haphazardly is a recipe for an explosion in infections.
Those who pick such discarded masks, particularly our children, are at risk of infections. There is also the danger of infection by those who come into contact with face masks blown by the wind. Careless littering and handling of COVID-19 medical waste.
Health authorities suggest that failure to observe safety protocols and incorrect disposal of protective gear is one of the reasons infections and subsequently fatalities are on the rise. Today, 605 new cases were reported from 4,547 samples, taking the tally of infections to 23,202 since the outbreak. This is a positivity rate of 13.3%. 4 police officers and 12 individuals held at Kianyaga Police Station, Kirinyaga County, have tested positive, with medics seen streaming into the police station after the revelation. The police station, which has 3 cells, and able to separate the positive cases from those who tested negative. The station will be fumigated, with those who return positive results scenes isolated at a ward in Kerugoya. There is no immediate clarity on whether the 12 cases have been accounted for by the Ministry of Health, which did not factor them in the Tuesday update. The national death toll from the virus is up to 388 after an additional 6 patients succumbed to the disease. The recovery's toll has gone up to 9,327 after 587 patients were declared COVID-19 recovered. Solidarity forever. Meanwhile, nurses in Homa Bay County held demos over unpaid salaries, vowing to stay home from work until their demands are met. In the face of a disgruntled health workforce over unpaid salaries and the quality of personal protective equipment, the Ministry of Health insists that this group remains as the most essential in the fight against COVID-19. Gov't, Citizen TV, Nairobi.